So my name is Neil Calman, and I am a family physician, and I have been working with Bronx Health Reach now for more than almost a dozen years. And I want to tell you a little bit from the perspective of a doctor that's been practicing in the community here for 30 years, what it's like to take care of people in this community, and why it is that, for me, Bronx Health Reach is more than just having meetings, and more than just telling people about diabetes, and more than just caring for people in the office, but it's become one of the most important things that I think I do in my life. What do people want when they go to see a doctor? Well, I think first of all, they want to know that they're getting the best possible care that they can get. They want to know that their doctors are smart, that they're well educated, and mostly that they care about them, that they really care about them in their heart. And that happens oftentimes through long-term relationships that people have with doctors. And they also want information and communication. They want people to speak to them, to talk to them as intelligent human beings, to explain to them what's going on, to take the time to listen so that stories like Vanessa's don't happen. You know, that they don't just pass them off and say, you know, it's something you ate, or it's, you know, you need a hobby, but that they truly listen to what people's problems are, and that they pay attention to them, and that they care about getting the right answers to the issues that are brought forward. They pay attention to them, and that they care about getting the right answers to the issues that are brought forward. When I set out to practice 30 years ago, my goal in starting the organization that I now run, which is called the Institute for Family Health, was basically to see that we could deliver private medical care, the kind of care that people get when they have good insurance and they go to a private doctor who's been their doctor all their life. Could we, in fact, deliver that type of care to everyone? And in our organization, that's our goal. But we have a terrible problem, and that problem is where we have to send people out for specialty care. And one of the things that happens when I need to send somebody to a cardiologist is I need to look at the kind of insurance that they have. Because if people that I'm taking care of have private insurance, I can call up a cardiologist that I know, and I can say, you know, here's a patient and this is what their problem is, can you see them? And they'll be very happy to see them, because I can send them to their office and they'll send me back a beautiful report, or maybe even call me 5 minutes after the patient leaves their office and say, I just saw this patient of yours and here's what I think, and here's what we would do. And I get back a good report and we can coordinate care. But that's not the way poor people in New York get their health care. Poor people in New York get their health care in clinics that are run by trainees, medical students, interns, and residents. And of course, there's an attending physician somewhere in the background because the law requires it. But you may never ever see that person. You're likely never to see that person. And those interns and residents rotate through these clinics every month or every 2 months. So when people go in, all of you that raised your hands that said you see different people all the time you go, it's because the people you're seeing are in training. And one month they're in the intensive care unit training, and the next month they're out in the clinic training, and the next month they're off at some other hospital. And there's no continuity of care. And those clinics do not connect back up to the doctors that refer them. So we don't get reports back. We don't know what happens. And there's no way for you to call anybody because you don't really know who your doctor is. So we've been saying, why is it that we allow in New York, where we spend all of this money on healthcare and where hospitals get billions of dollars in public money, when you pay your taxes, those taxes go to support the hospital system. Why is it in this city that we allow hospitals to have different systems of care for people based upon the type of insurance? Why can't we insist that everybody be taken care of in a single system? And that's a question that we've been asking now for almost 15 years. And the answers we get are terrifying. And they go right to the heart of the video that you saw about the role that race plays in our society. The answers we get are, well, if we want to continue to recruit the kinds of patients from New Jersey and Long Island and Upper Westchester and stuff like that into our into our hospital, we know they're not going to come if they have to sit in the clinics with everybody else and wait for hours. And I say, why does anybody have to wait for hours? Why can't you run a single system where nobody has to wait for hours? And the reason why people in clinics wait for hours is because the people who have insurance and who have doctors are in a different system. So they don't have to complain. And so we say to them, why is it that happens? Then I say, why is it that I can't get a report back from a cardiologist in a clinic? Why is it that they can't send me a report back? And they say, because we don't have any resources. We don't have enough money to pay secretaries and people to write those reports to send back from the clinic system. And I say, how come I can get reports back from the private doctors that work right down the hall from the clinics in the same place with the same institutional sign over the wall? And believe me, if the private patients were there in the same setting as the clinics, what would happen is they would say, why the hell don't you send my doctor back the reports that they're expecting? But what happens is we separate people into different types of care. And so what we've ended up with is a completely inferior care system where most people who are poor, on Medicaid, uninsured in this city get their care. And that system creates a result where we have 2 to 3 times the amputation rates for people of color in this city as we have for whites with exactly the same disease. So how is it that you can explain that in a city like this, that if you're African American or Latino, that you're 3 times more likely to have a body part that has to be amputated with diabetes than if you're white? Why is it? Because we have different systems of care. Why is it that you're twice as likely to have a life-saving cardiac procedure, a bypass surgery or something, if you're white or a person, if you're white than if you're a person of color in this city? Because we have different systems of care. And those different systems create different outcomes. So I'm going to end with 2 little stories of my own. And these are stories about patients that I take care of. And this one of them took place just a couple of months ago. One of my patients who went to the emergency room at Montefiore is a diabetic patient, very, very severe diabetes. And he went into the emergency room because he woke up one morning and saw an infection in his toe. And he said, ooh, I remember Dr. Calman told me if I have an infection in my toe, that's serious. And he went into the emergency room, and a doctor walked into the emergency room, picked up the sheet like this, looked at his toe, and said, that's got to come off. And that was the entire conversation the doctor had with him. And he said, what do you mean that's got to come off? And he said, it's got to come off. And so he said, you know, I want you to call my regular doctor. So he gave them my phone number and he gave them all the information, but I never got a phone call from anybody at the hospital because they just thought that this guy was probably not important enough to really take the time to do the things that they would do if he had been privately insured and white. So they basically said, well, we'll admit you. And they admitted him to the hospital, but he sat in the emergency room about 8 hours. And after about 8 hours, he was starving, and he said, look, I have to take my diabetes medication, and I have to have something to eat, because I took my medication this morning, and I can't take my medication and not eat. And they said, but the doctor ordered nothing for you to eat because you're going to surgery. And he said, surgery? What are you talking about? They said, yes. You're scheduled for surgery to have your toe amputated in the morning. And he had never signed a consent, done anything like that. And fortunately, he was smart enough to refuse. And he said, I absolutely refuse to have surgery. And they said, but you've already failed at your treatment with oral antibiotics, meaning that they thought that he had already taken some. And he said, what are you talking about? I've never had any antibiotics. Why don't you at least, that's really why I came here. And they said, oh no, you already failed with that. And he said, I don't know what you're talking about. Well, it turns out that the nurse had taken a history, and he had told them that he had taken some antibiotics a few months before for urinary infection. But this doctor never took the time to really look at the note carefully and said, oh, well, he's already had antibiotics. That didn't work. Let's just take off his toe. And that's the kind of medical care that people get when they don't have doctors that are their regular doctors, when they can't trust the system, and when the people who are caring for them, treat them in that kind of a way. And the last story I'm going to tell you is a doctor story. We got invited by our hospital to come and meet with the cancer doctors in our hospital because they wanted us to keep referring more cancer patients to them. And so they held a little breakfast, and they served us a very nice breakfast, and they wanted to tell us all about the cancer treatment. And one of the doctors who was with us turned to the head of the cancer service and said, "So what would you do if we sent you a patient who doesn't have insurance?" And he said, "Well, of course we would treat them." And then one of the other cancer doctors sitting right next to him said, "Well, we shouldn't really mislead these nice doctors, should we?" He said, "We will treat them, but they're not going to get the same medicine that people with insurance would get." And they're saying this to me as a physician. There is no shame. The system is not ashamed of the way it deals with people. It's been like this for so many years that people think this is the right way to practice. And the most tragic part of it is in these institutions in New York. That's where we're training the next generation of doctors and nurses. And we're training them there, and they will come out with exactly the same values and believing exactly the same things and thinking that this kind of treatment is right because they grew up with it, they were trained in those places. And so we are going to introduce legislation. Assemblyman Benjamin, I'm calling you doctor already, you see? Assemblyman Benjamin has already introduced some legislation in the Assembly. We are going to be working to pass a law that basically makes it illegal for hospitals to have multiple systems of care for the same patients. And that's been a goal of ours for years. It's going to happen, and hopefully we'll be able to have a big party in a couple of years to celebrate the end of this discriminatory system. Thank you.